Anaphylaxis is a sudden onset allergic reaction. It can occur within moments to up to 2 hours after exposure to the allergen. It is important to recognize anaphylaxis when it is occurring and treat it quickly. To keep it simple, you can recognize anaphylaxis if one of these symptoms is happening. Number 1, difficulty or noisy breathing. This can be coughing, wheezing, or labored breathing, or a hoarse voice. Number 2, vomiting and/or severe abdominal cramps. I usually say vomiting more than once because some people vomit once and look or feel much better immediately afterward. However, if there is vomiting and the person looks worse or vomits again, treat this as anaphylaxis. Number 3, feeling dizzy, looking lethargic, or fainting. In a young child, they may look unusually sleepy. In an older person, they may look pale and confused. If you have identified anaphylaxis based on one of the items listed here, use an epinephrine autoinjector immediately, then take the person to the nearest emergency room or call 911. There are often early warning signs, such as an itchy mouth or throat, facial swelling, or hives on the skin. If these are the only signs that appear, the epinephrine autoinjector is not required. However, if you are ever in doubt, for example, if the person has hives and swelling and looks unwell, just give the injection. It is better to use the injector when it is not really needed than to miss the opportunity to cure anaphylaxis. A side note, oftentimes itch and hives will disappear on their own given some time. However, if the person is uncomfortable from the itch or hives, a non-sedating antihistamine such as Claritin, Reactin, or Aries can be given to make them feel more comfortable. Benadryl should be avoided because it makes the person drowsy, and this can be confused with anaphylaxis. It is important to remember that antihistamines are not a substitute for epinephrine, and it is not the first step in treatment of anaphylaxis. If the person has anaphylaxis, do not waste time giving an antihistamine and go directly to the epinephrine autoinjector. Emerade 0.3 milligrams is for children and adults over 25 kilograms or 55 pounds, and Emerade 0.5 milligrams is for select teens and adults over 60 kilograms or 132 pounds. The Emerade has a cap and needle that comes out of the same end. All you need to do is remove the cap and place the end against your outer thigh. Once you have pressed, you will count to 5 and release. 1, 2, 3, 4, 5. Once you have done that, you should take yourself to the nearest emergency room or call 911. If you have any questions, feel free to contact our clinic.